So, Dr. Preethi, thank you so much, Doctor, for coming to the show. So the first question I would like to ask you is, what are the common myths that people have about suicide prevention?
Sure. Yeah. So first off, thank you for having me. I'm glad to be here
Yeah.
to share some of my expertise or experience about suicide
Yeah.
with your audience.
Yeah.
So I mean, like there are a lot of myths because suicide and suicide prevention is still a bit of a taboo, a
Yeah.
stigma topic around the world,
Yeah.
but in our country as well. So there are a lot of myths, as we would
Yeah.
know, that we experience on a day-to-day basis. I think one of the most common myths is that talking about suicide
Yeah.
is a bad thing,
Mm.
and that if you actually talk about suicide to someone, you could be planting the idea of suicide in their mind, or you might instigate them or provoke them towards suicide. But that is quite a myth, because the reality is that if someone brings up the topic of suicide or leads you into that conversation, it's probably already on their mind. And starting a conversation about it in a very respectful, gentle, non-confrontational, non-judgmental way would actually help someone who's at risk, because it helps them to realize that they can open up and share what's on their mind. They can share about their difficulties, that they can get the help that they need. And it might also help them realize that they're going to be able to talk to professionals as well in a way that's not going to allow them to be judged. It also helps us, the person who's listening, to understand how much this is on their mind, or how severe the risk of suicide is on the mind. So that's one of the big myths, that you shouldn't talk about it.
Yeah.
In fact, just the whole idea of observing Suicide Prevention Day every September 10th is the idea that we can talk about this and start conversations about it. And another major myth is that about suicide and suicide prevention is that if someone talks about suicide, then they're just asking for attention, they're not really serious about it. Again, there's a reality to it, and the reality is that if someone has had the courage to speak about it, it's most likely because they want help.
Yeah.
Right? And many times people who bring it up are looking for help and for empathy and compassion and understanding. And so they many times don't want to go forward with suicide, right? And rather than asking for attention, they're asking for help. And that's what we can offer them. So that's another major myth. And there are, of course, many more, but I think these are kind of summarizing a lot of what we understand as the misconceptions around suicide.
Yeah, I mean the main, I think the fact that you can't talk about it is it's like the starting point, right? That you
Absolutely.
can't even talk about it. So
Yes.
so do you think like the fact that you can't talk about it from childhood, like these kind of topics might be very sensitive for a kid. Sometimes they might not talk about it. Do you think is it safe to start it from from a younger age to these conversations or?
Absolutely. And yes, absolutely, because we know that if you look at the news headlines, you'll know that death by suicides are on the rise in all age groups, including among youngsters and youth. In fact, it's one of the leading causes of death in young people.
Yeah.
The news tells us that deaths by suicide are so high, especially in across the world and including in India. We kind of ignore that by not talking about it with our youth and teens. Of course, there is a way of talking about it with every age group, whether with a child or an adolescent, but we cannot deny the reality that this exists. And so, even something like talking about mental health, right?
Yeah.
Which could predispose a person or could, take them closer to think about suicide is important. Letting them know that things like anxiety exist, letting them know that if they are feeling low or depressed or anxious, they can reach out for help, could go a long way towards breaking the stigma about mental health and suicide.
Sure.
Later on. Yeah.
So, what are like the common warning signs, that someone may be having suicide thoughts?
Right. Yeah. Yes, that's a very good question, because many times we feel like suicide occurs out of the blue. We, had no idea it was going to happen. But again, the reality is that, around 70 to 80% of people have given some clues verbally or behaviorally or in some way to the world around them that they're not doing okay. So it's important for you, me, and for everyone out there to be alert to these signs so we can pick it up. So these signs, warning signs that someone is not doing well, could be verbal, which means something that they may say in their words that tell us they're not doing well, including I've not been feeling like myself, right? I feel like, what's the point of life? I feel like, what's the point of living? I feel like giving up. Yeah.
Yeah.
I feel like such a burden to everyone.
Yeah.
I feel like I don't matter to anyone. Yeah. I feel like no one loves me. Very indirect verbal signs that someone is going through it.
Yeah.
And of course, these signs could be more verbal. I mean, could be more direct.
Yeah,
Like,
yeah.
I've thought about killing myself. I wish I could end it all. Right. And these are very, either indirect or direct signs people let us know verbally. The second category of warning signs could be in terms of behavior.
Yeah.
Someone may not say anything, but you get an idea from their overall behavior. Maybe their sleep patterns are very disturbed. Maybe their appetite is very, very low, or very low as compared to earlier. Maybe there are dramatic changes in terms of their mood. Maybe you find that they are isolating and not interacting with family or friends as they used to, right? And sometimes we also see that individuals who are thinking about suicide have researched means, to hurt themselves. They may have talked about it with friends, or they may have, in fact, put affairs in order, kind of settle things, told them, if I'm not here, I want you to do this. If I'm not here, I want this person to take care of my loved one. That kind of hint through their behavior that something's amiss. And thirdly, in terms of their psychological or mental state, we should also be alert. Like someone who's showing change in mood, who appears quite anxious as compared to earlier, who is maybe engaging in increased substance use, alcohol or drug use, right? And someone who just seems a lot more disturbed or distressed as usual, could also hint to us that something's not well. So maybe it's useful to keep in mind these categories of warning signs that could.
Yeah. So that's why I think the first and the second question, they're connected, right? Because one, if you can't talk about suicide prevention, and then the fact that when it happens and it's a surprise to them. So I
Absolutely.
think that's why it's connected. So my
Right.
next question to you would be like, what are the risk factors that someone, that makes someone more likely to attempt suicide?
Yes. Yeah. So you're absolutely right. If we break our myths, we're able to know we can talk about it, then we are alert to the warning signs, and we know who to watch out for these warning signs, and that's the risk factors.
Yeah.
We're a lot better set, isn't it?
Yeah.
So who are the individuals who may be a little more at risk for maybe experiencing suicidal ideations? I think the first would be, of course, someone who's going through mental health difficulties, including things like anxiety or depression, or substance use, various things, substance use, disorders. Because it's not that everyone who thinks about suicide or attempts suicide has a mental health issue, but of course the likelihood is a little higher in someone who's going through a mental health difficulty. Right? And so knowing that someone's going through depression would mean that we are aware that the risks are a little higher. Knowing that someone's going through a chronic physical or medical health issue should also alert us to that, because when someone's going through a chronic health issue that they're suffering with for many years, that puts a lot of financial burden on them or on their families, or that makes them feel quite often physically and emotionally dependent on others around them, could also lead to suicidal thoughts. Right? Similarly, someone who's had a family history of someone who's died by suicide in their family, because at times there is a genetic basis also to this. Right? So knowing that also makes us a little bit aware. Similarly, someone who's attempted suicide before. Many times we think that if someone's attempted suicide earlier, they would not attempt it again. But the reality is sometimes the opposite. There is a higher risk if the person's already attempted suicide, and we should therefore, our eyes should be a little more open, or a little more watchful and helpful and compassionate, to someone who's already attempted suicide earlier. Now, knowing that there are also people who go through acute life stressors, let's say going through circumstances like financial difficulties or unemployment, who've gone through some very difficult circumstances of loss or grief, or something else that has been very hard to deal with in the current moment. And they also may be at risk for thinking or contemplating about suicide. And people who've gone through hard experiences in the past, let's say abusive experiences as children or in their childhood or adulthood, right, are often quite hurt by this and vulnerable as a result to experiencing suicidal thoughts later. And one very important frame of reference we know is that if someone is experiencing the feeling of being a burden to others around them, if they feel that no one loves them, so they feel isolated, I don't belong, no one cares for me, they feel hopeless. Things are not going to get better. These are often very important risk factors that if we know someone's feeling this way and verbalizes it, then we know that all these contribute together towards a sort of a decreased desire to live and an increased possibility of thinking about suicide. So all this comes together to help us realize that if someone who has these risk factors then exhibits warning signs of suicide, then we should be much, much more alert.
Yeah. That's a thing, right? Like a lot of people, like the ones who don't, they think it's sudden, but it slowly builds up,
Absolutely.
for years after years for them.
Absolutely.
So that leads to my next question. What are the, some of the preventive measures that can help someone resist suicidal thoughts?
Right. And like you guys rightly said, it could build up over years or maybe months or days. And so I think the steps we do to prevent us feeling or coming to the point where we think about dying by suicide is we take those measures on a daily basis. So we term these measures as our mental hygiene habits, right? We all talk about dental hygiene, we all talk about physical hygiene, but mental hygiene habits, which are so important that we do on a daily basis. So some examples of that, kind of overlap with, physical health, taking care of our eating habits, making sure we're getting enough sleep, because we all know that when we're sleep deprived, we're not in a good emotional state, right? Getting physical exercise, which contributes to feeling mentally a state of mental well-being. Another very important preventive measure for your overall mental health, mental hygiene, is with regard to staying socially connected, right, to people around us, to people who care for us, to the community we live in. Even one or two close relationships or friendships can be a great protective factor against later depression or suicidal thoughts. So it doesn't have to be a group of 20, 30 people, just a couple of close people I know I can call up and say, I'm not doing good. It goes a long way. So staying connected, not isolating with people around us, taking time every day to do things that are important for us, right? Whether it's our spiritual life or whether it's self-care activities or things that improve our mood is also very important, towards daily mental hygiene. And all of this put together in the long run is so important towards preventing suicidal thoughts. But at the end of the day, if you know you're not doing well, the most important thing is to reach out. You can do all of this and still feel low. All of us are vulnerable at any point of time. So when we know we're there, to be able to reach out for help is very important.
So just a side question. So since you said one of the most important ways can be being socially connected and reaching out to people. So sometimes when people actually talk about having suicidal thoughts to people, at that moment they don't know what to do when someone tells them, they don't know how to respond to them. They're very scared. So how can they, when someone tells them that they're having suicidal thoughts, how can they deal with that situation?
Absolutely. Yeah. I mean, this is so important, isn't it? Because if I am experiencing suicidal thoughts and I come and open up to you and, you can be uncomfortable and you might be like unsure what to say. But as long as you're conveying empathy and compassion, it goes a long way, right? So it's very important, I think, for all of us to know if someone has taken the courage to open up, how do we respond? And I think there are some simple steps we can keep in mind. Number one is we need to be, like I said, we need to be watchful, right? To be able to then, if I suspect that someone's not doing well, then I can be that friend or that person who says, hey, I kind of sense that you've not been doing well. Kind of noticed you're not like yourself over the last few weeks. Something bothering you. You can open up and tell me, right? In a very gentle, respectful way. So, if that person's not able to start the conversation, maybe I can. But let's say then the conversation starts off, to be able to say, yeah, the person says, yes, I've not been feeling good. This is what's been happening. This is what I've been struggling with. There are certain do's and don'ts, right? Some of the don'ts, because those are easier to start off with. Some of the don'ts, we don't want to preach. We don't want to lecture. Kind of goes together. We don't want to interrogate. Why? What happened? Like, why are you feeling this way? What happened? Tell me about it. Who's been treating you? We don't want to interrogate. right? We don't want to dispense advice, which is like a prescription out there. You know, do this and you'll feel better, right? Do a little bit of exercise, engage your mind. We don't want to dispense advice at that point, because this is a person reaching out for help. Instead, we want to listen.
Yeah.
Our main task at that point is just to be an empathetic listener who's just able to say, I'm here. Listen, I mean, tell me what, if you're able to share with me what you're going through, I'd love to help. So you're able to listen without judgment, without all those don'ts. And then I think the next important thing is to kind of make sure from your part, from your side, that the person is safe. You've listened, you've heard them out, you've assured them you're going to be with them. You also try and do your bit towards making sure that once they walk away from you today, they're safe, right? And so you kind of have conversations about how you can do that. Can you keep in touch with me? Can you make sure there's no access to dangerous materials which could be used to hurt themselves? Could you make sure they're not alone with their consent, right? Could you take those simple measures to make sure they're safe, and then tell them if you need professional help? Let's say you've spoken to me, I'm here as a friend, but I may not be able to do much. I'd be happy to come with you to meet a counselor, or a counselor or a psychologist or psychiatrist. I'd come with you, I'd happy to come with you. Shall we do that together? Because we know that a lot of times that helps that person reach the help they need.
So, since you mentioned that, reaching out to a counselor, is one of the best things. So, just leading to the next question, what are like the resources available for someone, who's having suicidal thoughts, or someone who's lost someone due to suicide?
Okay, so breaking that down, right? What are the resources available for someone who's experiencing suicidal thoughts? I think the first thing is they should know they can reach out to someone. That someone could be in their immediate circle, a friend, a family member, a trustworthy person. They know they can reach out to someone maybe who they look up to, a mentor, maybe a spiritual or a professional mentor, or someone, an elder in the community they respect, who should also know how to help them. And then if they're feeling comfortable, then they can also approach a professional, which could be a counselor, a psychologist, a clinical or counseling psychologist, a psychiatrist, right? Someone who knows how to help them. And all these resources are there to help them when they're feeling low or depressed. But let's say at that moment when they're feeling extremely low and suicide is heavy on their mind, we also know that there are suicide helplines in place, manned by professionals, manned by usually volunteers who are trained. And there are a list of good helplines available, so that if someone is feeling really low, they know they can pick up, even if it's at 2 a.m. in the morning, because a lot of us are vulnerable at 2 a.m. in the morning, to be able to pick up the phone and call someone, get through that night, and then access more long-term help.
We've spoken about people who have suicidal thoughts, but let's talk about the people who have lost, someone who's because of suicide. What can they do during that time, when they are going through that grief, losing to suicide?
Yes, and this is because many times, because of stigma and because of the very nature of suicide, the families who've lost someone to suicide go through so much themselves. They go through feelings of shame. They go through feelings of isolation. People don't know how to broach it with them, how to talk to them. Even if they've lost someone to any other way, let's say a physical illness, we're there. We say, what can we do? But when it's suicide, then we might say, okay, how do I talk about it? I think the most important thing for us as communities is to realize that the family is grieving, and not to be uncomfortable or not to be reluctant to offer ourselves as help, right? Compassionate help, practical ways of helping, right? Because often families going through suicide who have, gone through it and emerged, come on the other side, need help but are not getting the support that they need. So offering practical help like we would to anyone else who's grieving, ways that I could help you, ways that I can support you, whether emotionally, materially, or whatever, and compassionately. Just because the family seems to be, going about their daily life doesn't mean they're grieving. And I think that support has to continue for months, maybe years at times, to let them know that this is not something they need to be ashamed about or we don't want to talk about. So the community coming together to help the family is extremely important.
So that comes to my last question. So what are the, how can we create a culture of support and, understanding for people who are struggling with suicidal thoughts? And as individuals, what can, we do as a family, as a community? What are the things that we can do?
Right, absolutely. I think as individuals, we need to be watchful and caring for those around us,
Yeah.
right? Like we've talked about all through today, be watchful for someone who's vulnerable,
Yeah.
be looking out if there are something that catches our eye, be okay to talk about it in loving and caring ways, right? And to be able to help that person access the help that they need.
Yeah.
As communities, I think there's so much that we can do, right? And that's why Suicide Prevention Day is all about starting conversations, changing the narratives about suicide, right? So it's being able to say, okay, let's not make it a stigmatized topic anymore. Let's, talk about it at our level, whether it's, as a in our workplace or in our community. So to be able to change the narrative about suicide, so it's not such a taboo topic, and someone can get the help if they need it. Right? It's also about, let's say, for example, as a community, knowing that individuals who are lonely and isolated, who feel that they're a burden, right, are especially at risk. I think we as communities have to help individuals feel cared for and belonged to,
Yeah.
right? So what does that mean at an office party if you realize that someone's at an office get together, you notice that someone's out, feeling left out, making simple steps to make them feel included. You notice in your family there's not people who don't feel welcomed, making those efforts to make them feel like they are loved for and cared by as your family or by your community, because that can go a long way. And then I think also knowing that there are certain things that leave individuals vulnerable to suicide, like unemployment, poverty, physical health issues. We need to be able to, if we notice something like that happening, we need to be able to work with those issues as well, right? If someone's financially struggling and we're saying, here, we're here for you, but they're still financially struggling, maybe the financial support goes a long way towards helping them feel less hopeless or less vulnerable. So, tackling those issues of, let's say, poverty, unemployment, abuse that we may notice in the families around us, all of this again, tackling those societal issues, I think those social issues that we see around us could also mean those individuals who are vulnerable to suicide get the help they need, and then, need not feel so alone at a larger level.
So that's the thing, right? Like having the conversation and talking what it is like. It's the grassroots level, right?
Absolutely.
So once they start that, only the suicide prevention can happen, because it's not something that can happen, immediately, right? It's something that takes many years also of a conversation to be comfortable.
Absolutely.
So thank you so much, FEBA viewers, for seeing this episode, and I would like to thank Doctor for coming here. So thank you so much, Doctor.
Thank you. Thank you.
So if you ever want to get in touch with us, you can definitely get in touch with us at 6364252164. See you next week.